and welcome to St. Lucia Magazine, your weekly roundup of the nation's top stories in education, the economy, infrastructure, agriculture, and more. I am your host, Kendall Eugene, standing in for Nivalo Geist. In this edition, the VAT waiver on building materials continues, and St. Lucia advances transportation reform with a new mobility study. The government of St. Lucia is extending key cost of living relief measures. Nivalo Geist has the details.
The government of St. Lucia has announced an extension of VAT relief on building materials for an additional 2 years. Prime Minister Honorable Philip J. Pierce said the measure is part of government's ongoing efforts to address rising costs and support continued growth in the construction sector.
We are going to be continuing the zero-rated items for building materials. That happened for another 2 years. Building materials will continue to be zero-rated as far as VAT is concerned, and the service charge on food items, which was being waived, will continue to be waived. So we're continuing our thrust in trying to reduce the impact of rising prices on the public of St. Lucia, and 2, trying to continue the building boom that is evident in St. Lucia.
According to Honorable Philip J. Pierre, the measures are intended to address inflationary pressures while encouraging investment in housing and infrastructure. For the Government Information Service, I am Nival Auguste.
Efforts to improve mobility and strengthen economic productivity are receiving renewed attention from the government of St. Lucia. Here again is Nival Auguste.
Is reviewing recommendations contained in a transportation study supported by the Caribbean Development Bank. Prime Minister Honorable Philip J. Pierce said the report goes beyond bus fares and addresses broader transportation challenges affecting commuters and businesses.
There is a report, and the Minister of Transport will be dealing with it. There's a whole transport study that's happening. We want to speak about bus terminals. It's a major hazard. The buses all over the road. So in the next budget, I'm going to make a statement on bus terminals. We need to have a centralized space to put our buses. That's going to be one of our programs in the next budget.
The Prime Minister highlighted transportation difficulties faced by workers, particularly those employed in the tourism sector.
There's a problem with transportation. I mean, part of the economic issues in the country, as far as employment is concerned, is that people who live out of cashews can't get transportation to get to their homes after work, particularly hotel workers. It's a serious problem.
Prime Minister Pierre noted that the minister responsible for transport will provide further details on the report and any resulting policy decisions. For the Government Information Service, I am Nival Auguste.
St. Lucia's tourism sector is maintaining its upward trajectory with strong performances across several key visitor markets. Petula Olibert tells us more.
St. Lucia's tourism industry continues to perform strongly, with the island recording its highest ever stay-over arrivals in the month of April. Speaking at a press briefing on May 26, Tourism Minister Honorable Dr. Ernest Hilaire outlined the latest visitor arrival statistics, which highlighted significant growth.
In April 2026, stay-over arrivals total 40,752, representing an 8.5% increase compared to April 2025, which was 37,546. This level of arrivals reflects the highest on record for stay-over arrivals in the month of April. This strong performance reflects a notable improvement in visitor demand during the month, and signals continued resilience in the stayover segment.
The positive momentum was not limited to the month of April. Dr. Hilaire reported continued growth in stayover arrivals during the first 4 months of 2026. Cruise tourism also recorded notable gains, contributing to the sector's overall strong performance.
Cruise arrivals in April 2026 total 53,461, representing a 34% increase compared to April 2025, which was 49,756. On a year-to-date basis, cruise arrivals reached 418,174, up 9% over the same period in 2025.
Overall visitor arrivals, including stayover, cruise, and yachting visitors, totaled 99,162 in April 2026, representing a 23% increase compared to April 2025. Minister Hilaire noted that while the United States remains St. Lucia's largest source market, the United Kingdom recorded a slight decline in visitor arrivals. Canada, however, showed strong growth, while the Caribbean market also delivered impressive gains during the month. Petula Olibert reporting for the Government Information Service.
The next generation of St. Lucian entertainers got an opportunity to develop their skills and gain hands-on industry experience at a recently held Carnival workshop. The Carnival Planning and Management Committee, CPMC, concluded its highly anticipated Junior Carnival Tour with a youth workshop aimed at nurturing and fine-tuning emerging talent within the entertainment industry. Dubbed the Creative Arts and Training Program, the initiative brought together students from various secondary schools across the island for an interactive session that covered the fundamentals of emceeing, event hosting, and event production. The chairperson of the CPMC, Tamara Gibson, hailed the success of the school tour as it set the tone for the Junior Carnival events, including Junior Calypso and Soca Monarch, Junior Panorama, and the highly anticipated Junior Carnival Parade scheduled for July 12.
Lucian Junior Carnival 2026, it's well on its way. Today, we end the National Schools Tour. Over the past 2 weeks, we visited a total of 22 schools, both infant, primary, and secondary across St. Lucia. It was a very exciting tour, and it's something that we know that the schools now look forward to. So this year we're happy to say that we're very pleased with the outcome, and as we end the school tour today, we move right into the school events. This is our second year having the soca competition, and last year we saw so much effort being put into this competition by the students. We're pleased to see how they have been developing, and we have to thank Mr. Jason Bachelor Joseph for his continued effort and support to ensure that the children deliver their best year.
According to CPMC marketing lead Mindy Chico, the workshop formed part of a broader program that the Carnival Planning and Management Committee has developed for Lucian Carnival.
Today's workshop was all about the creative industries and MC hosting. Why we decided to put on this initiative, it forms part of a larger program that the Carnival Planning and Management Committee has put together for Lucian Junior Carnival. The program is called the Creative Arts and Training Program. This program encompasses the training today, also a creative arts component where the students will be building a costume, as well as integrating the students into the overall production of the Lucian Junior Carnival program, and of course having those students as well become hosts of the junior program.
Chico noted that the CPMC intends to continue the inaugural workshop as it complements the committee's mandate to develop and support young talent.
Last year, we started with having 2 students co-host the junior shows, and this was phenomenal, and we received great feedback from the crowd as well as from the ministry. This year, we decided to take it a step further. One of our overarching pillars of Lucian Carnival is sustainability, and this ties in very nicely with that. We want to help to grow the industry as well as continue to have Carnival seen as one of the premier festivals on the island. So This is the first of its kind in the form of the workshop, and it's something that we hope to continue as we bring up more students, specifically the theater arts ones, who are interested in all aspects of the production of Lucian Carnival.
In addition to gaining valuable insights from the workshop panel, which included industry professionals Minerva Ross, Lavelle Duboulet, Herma DeMarc, and Kendall Scaddy Eugene, participants were awarded with certificates of attendance at the conclusion of the workshop. For the Government Information Service, I am Kendall Eugene. Still to come, preparations are underway for the 2026 Atlantic hurricane season. Stay with us.
Département écoutez, justice sociale, gender et puis droits citoyens, car informer public là et envoyer paiement approcher 1200 familles qui te ka hen bénéfice à bas programme assistant public. Département ka implémenté décision ça là parce que ces familles ça là participer à dans deux process review qui point cours à l'année 2025 et puis l'année 2026. Département comité pour un service pour toute famille qui qualifié et puis qui a participé dans le process review. Moun qui sont affectés par décision ça là, département a encouragé pour contacter le département à numéro 7D 3 D399 ou 7D4 8957 ou visiter office welfare qui est en commune. Département écoutez justice sociale, gender et puis grand citoyen voulez remercier public là pour coopération et puis la compagnie.
Welcome back. The German International Development and Cooperation Agency, GIZ, has provided support for St. Lucia's technical and vocational education. Ryan O'Brien explains.
An official ceremony marked the formal handover of training equipment provided through the Green and Blue Skills Project and the NDC Tech Project in support of strengthening technical and vocational training TVET in St. Lucia. The equipment was made available through German cooperation and the GIZ, Germany's main development agency, providing international cooperation services to promote sustainable development worldwide. The handing over was held at the School of Innovation and Technology, Angers. School principal Augusta Emmanuel John spoke about the likely impact of such a donation.
These equipment represent more than just tools and machinery. They are an investment in the future of our students. They will help us provide increased opportunities for hands-on learning, skills development, innovation, and career readiness, thereby ensuring that our students are better prepared to meet the demands of the modern workforce. On behalf of my staff and students, I extend sincere appreciation to all the partners and stakeholders who have made this initiative possible.
Technical advisor to the GIZ, Sarah Stadler, noted that the donation was part of her organization's mandate to bring about meaningful change in developing states.
Although we have not known each other for very long, it already feels as though we are working as one team, a team united by a common purpose, preparing young people and workers for the jobs of the future. And that future is arriving faster than ever. Across the Caribbean and globally, global labor markets are undergoing profound transformation. Technological advancements, climate change, digitalization, and the transition to greener economies are reshaping the skills that employers demand today.
Education Officer TVET, Dr. Delphia Natrum, disclosed that the TVET schools are preparing the workforce for emerging industries that promote stability, food security, environmental stewardship, and economic resilience.
The equipment being handed over today is a collection of tools and machines that is sure to drive opportunity, innovation, technology, and it serves really as an investment in our young people. This equipment will enhance the areas of agriculture, technology, and agro-processing with a view to food security to ensure a more sustainable approach to the occupational training linking to the blue and green economy.
Minister in the Ministry of Education, responsible for early childhood, continuing and special education, and Digital Transformation, the Honorable Danny Butcher, described the presentation as a significant investment in technical and vocational education and training.
Through initiatives such as this one, we continue elevating the status of technical and vocational education, demonstrating its critical role in national transformation. This program also reflects our commitment to climate resilience and sustainability. The Caribbean is among the regions most vulnerable to climate change. Therefore, we must ensure that our workforce is equipped to participate with the green economy. By exposing our students to these technologies and modern sustainable transport systems, we prepare them to contribute meaningfully to a cleaner and more resilient future.
Minister Butcher further emphasized that the equipment will bridge the gap between classroom theory and practical application. From the Department of Education and Digital Transformation, I'm Ryan O'Brien.
Health officials are stepping up preparations for the 2026 Atlantic hurricane season with a focus on strengthening the sector's readiness to respond to both traditional and emerging challenges. Monica McCoy reports.
The Ministry of Health, Wellness and Nutrition recently convened its 2026 Atlantic hurricane season preparedness meeting. The meeting brought together health sector leaders, heads of departments within the Ministry of Health, and administrators from the Millennium Heights Medical Complex, St. Jude Hospital, Grosley Polyclinic, Denry Hospital, and the Super Hospital to assess readiness for the upcoming Atlantic hurricane season. Opening the session, Chief Medical Officer Dr. Sharon Belmont-George welcomed participants and set the tone for the day's deliberations, adding that while St. Lucia's health response has always focused on health infrastructure and physical well-being of individuals in the aftermath of a storm, this hurricane season, the Ministry of Health is making an equally urgent commitment to the mental health of those affected.
Generally, I find we respond well to unusual circumstances. A lot of it in the past has been centered a lot on looking at the infrastructure, providing equipment, providing supplies. And the mental health aspect is usually delayed. A lot of the times it's almost an afterthought when we provide it after. This year we included mental health as part of the planning from very early. So as part of the response, whether it be people's homes are flooded and they've lost a lot, whether there's injuries or not, we have to cater to the mental health impact that storms and disasters present.
Minister for Health, Wellness and Nutrition, Honorable Moses Jabaptist, highlighted the growing concern of water shortages across the island and urged health officials to consider the implications of prolonged drought conditions on healthcare facilities and vulnerable communities.
Over the last few months, many communities have seen situations that we've never experienced in our lifetimes. Many of us have never experienced that kind of situation. In the constituency that I represent, we are seeing ravines. I saw ravines, a few ravines dry in the last 3 weeks that I've never seen before. I mean, I grew up in that area, in Grace and that kind of, and I've never seen ravines dry. And this year, I saw for the very first time a couple of ravines dry with stench, with animals dying and so on. So there is also the other side of it, that if for example, we continue to have that water deficit, it becomes a disaster.
Health Disaster Coordinator Dr. Delphina Werner briefed attendees on the potential effects of El Niño conditions and what this could mean for St. Lucia during the season.
Rainfall is going to be below normal, which means we're going to have longer dry spells, which we're already experiencing. I mean, other than the past week or so, we've been very, very dry. As far as the hurricanes are concerned, we will have fewer storms, as is shown in the prediction, but again, the ferocity of the storms may be much more. And as we've said, it only takes one event. temperatures will be warmer than normal, and that will contribute to increased heat stress.
Health officials say the annual preparedness meeting serves as a critical checkpoint for the entire health sector, ensuring that when the Atlantic hurricane season reaches its peak, St. Lucia's hospitals, clinics, and health units are ready to serve, protect, and respond. From the Communications Unit of the Ministry of Health, Wellness and Nutrition, I am Onika McCoy reporting.
Coming up next, the full commissioning of the St. Jude Hospital is set to boost healthcare access in southern St. Lucia.
This message is brought to you by the Ministry of Health, Wellness and Nutrition in collaboration with the Caribbean Development Bank and the Interdevelopment Bank.
Welcome back. Healthcare delivery, particularly for residents in the south of the island, is expected to receive a major boost following the full commissioning of the St. Jude Hospital. Dr. Sharon Belmar-George provides details.
The healthcare system in St. Lucia is made up of a varied network of systems, institutions and programs, both within the public sector and also the private sector. And this is brought through our hospitals, of which we have 3 statutory hospitals, the St. Jude Hospital and the Millennium Heights Medical Complex, together with the Tapia Hospital, which is our private facility. Within the primary care, we have a range of health facilities ranging from level 1 to level 4. Our level 4 facilities are our district or community hospitals and polyclinics, and our lower level facilities within the community. And these services, together with a wide range of private providers, from medical services to diagnostics as well within the country, are many services which we can't manage within St. Lucia. We also have relationships with external agencies for transfer. The St. Jude Hospital, which is located in the south, is an extremely important component of our health system. Keeping with the government's main national priority for health, that is universal health coverage, and also our National Strategic Plan for Health for 2025 to 2035, which both of them speak to ensuring accessible, affordable, and quality health care to the population. St. Jude Hospital, which is located in the south, provides secondary care services. One of the very important pillars in relation to providing universal health coverage is health equity. So the commissioning of St. Jude to the refurbished site will ensure that the residents in the south have access to quality of care within a facility that can provide the care at the standard that we need to provide it at. And it is important within the island for the population that we serve that we ensure that both of our health facilities are able to provide health care at a specific standard. That is a secondary care services such as surgery, delivery, dialysis, the capacity to manage emergencies. And St. Jude is located in the south, where our international airport is located. So it is also important that access to care, if there are any emergencies related to international travel, we are able to manage it. So we are working very closely with the committee at St. Jude to ensure that the services that will be provided meet the standard of care so that there is equity within the North and the South. We do expect the full commissioning of the hospital to support both our national strategic plan and the government's priority for universal health coverage. We have generally 2 levels of care within St. Lucia, and one of the areas that's important for universal health coverage is sustainable health financing and also reform. So apart from us providing quality health services, we have to ensure that it's done in an effective, efficient, cost-effective way, because we have to ensure sustainable financing to manage health care. Secondary health care services are much more expensive in their provision as compared to primary care services. One of the priorities for the ministry, and this falls under my office, we have been doing the necessary assessments of our district hospitals, for example, and our polyclinics. We are working on the expansion for expanded hours and also expanded services to include diagnostic services. And this will definitely support the improvement in services at the hospitals. One of the issues which we have been managing over the last few years are lots of complaints coming out of the emergency rooms at the hospitals. And part of it has to do with the limitations within care, within primary care, especially when it comes to diagnostics, and the limitations in our opening hours. If we are to extend our hours within key primary care facilities and also the services, we would be able to better manage the needs of the populations. So when we look at areas such as the Grosley Polyclinic, the Betty Wells, Dennery Soufre, and the Viewfort Wellness Centers, if we can increase the services that are provided and also the times, our patients will be able to access care closer to their communities, and it will reduce some of the complaints and the poor outcomes we get when patients wait extended hours within the hospitals. What will it mean for the 2 hospitals? They will now be able to concentrate their services on secondary care. So they would now be able to manage emergencies, deliveries, surgical procedures, the more complex hospital-based services. And we should get improved outcomes given an improved patient satisfaction. So it will improve quite a few of the pillars towards universal healthcare. That is, there will be better access, since you could access those services closer to your home. It will also be more affordable, because most of the services within our primary care are either free of charge or a lot more affordable, and it will be more economical for the government as well, since the provision of those services within primary care is at a lower cost as well. And quality of care would be improved, as there would be reduced waiting times, and we would be better able to manage the lower level services within primary care as well. The commissioning of St. Jude would be extremely important. It's also very timely to support universal health coverage. It will allow us to manage our patients a lot better, strengthening the referral systems from primary care to secondary care. And I think we've been managing, and I really have to commend the staff at the St. Jude Hospital. There is a very warm culture that exists within the South and the St. Jude Hospital. I really have to commend the staff for all of what they have been able to manage over the last few years within the stadium. So I think us reopening the St. Jude, the level of motivation, satisfaction, and the level of the providers giving care would also boost the quality of care that we are providing there. When the after St. Jude Hospital is fully commissioned, it would mean services would be provided in a safe environment that is actually set out for hospital care. So the spaces are a lot bigger. The equipment would be new and updated equipment. The processes as well are being updated. The clinical protocols are also updated. And we are looking to widen the services that are provided at the St. Jude Hospital.
And with that, we wrap up this edition of St. Lucia Magazine. A heartfelt thank you to everyone who contributed to this production, the National Television Network, the GIS team, and the communications officers across government ministries. Thank you for watching NTN Channel 122 and following the official social media pages of the Government of St. Lucia. I am Kendall Eugene. Until next time, stay informed, stay engaged as we continue tracking St. Lucia's progress.